Hi everyone, Dr. Emmy from Pain Free and Fit. Today I'm going to be sharing one of the most simple and best exercises you can do for disc herniations, bulges, and degenerative disc disease. Hope you enjoy. So patients and online clients are always asking me, Doc, if I just had to distill down my rehab program to one exercise, the most important for my disc herniations, my bulges, my degenerative disc disease, what would it be? I walk on a regular basis, but if I just wanted to supplement that with one exercise, what would I do? And my answer is the full spine extension exercise. This exercise is great for developing the extensors or muscles in your back that bring you up. Chronic low back problems have been shown to be helped by endurance extension exercise. Extension means any exercise that causes the hip to extend and the back to extend, preferably working together, utilizing the muscles of the gluteus, the buttocks, the erector spinae, the multifidus. A lot of these muscles are always atrophied or weak in chronic disc problems. So by using a strengthening exercise program 2 to 3 times a week, you'll help to build the endurance and the conditioning up of those muscles, many times helping with chronic disc problems. Let's review what you need to do this correctly, because there's a lot of people that will perform variations of this exercise that wind up actually aggravating their disc problems. Full spine extension is, by the looks of it, pretty simple. What you're doing is from the prone position, simply raising your chest and head a little bit as you squeeze the buttocks, draw your shoulder blades together and pull them down. Now, it looks simple, but there's a lot more to it so that it's effective for your unique condition. Number one, we want to avoid raising up too far, because the farther up we raise, the more we can compress the facet joints, disc herniations and bulges that are moving posteriorly. Although this position many times is going to be helpful, because as you extend slightly, it's going to force the disc material that's in your disc back forward from its posterior or backwards migration, the inner disc nucleus, which is restorative for the disc. Many times that material will become compressed and irritated. You'll aggravate sciatica, stenosis symptoms. So one of the key issues that I teach patients and online clients with this exercise is when they come up to emphasize more the extension from the mid-back between the shoulders rather than lower back. People that perform excessive extension by raising the legs like a Superman and the arms at the same time provide way too much arching or extension in the lower back. It puts a huge load on the spine, many times aggravates problems. So to modify this, what we'll do is we'll check that ability to overarch the lower back by tucking our tailbone slightly under and our pubic bone up, rocking the pelvis in a posterior tilt direction. That utilizes your abdominal muscles with this exercise, which a lot of people do not do, and that's a mistake, because you want to get a co-contraction between the abs in the front of your spine and the extensors in the back. So as you keep that tail under to a comfortable degree, you're then going to raise the head and the collarbone, just the top of the chest. You don't even have to lift the whole chest up. By raising just the collarbone a little bit and avoiding arching your neck by looking up, because as the neck arches, the low back arches also, you'll keep your face flat, just the collarbone lift, and then shoulder blades pinch together and hunch down towards your hips. You're maintaining tail under tension and buttock contraction. That's a proper full spine extension. You can do this for repetitions, holding for a few seconds, perhaps 2 to 5 seconds, and then releasing, or you can do it for prolonged static holds or isometric endurance times with your training. Now, that's a very simple, basic way to do this exercise, but to really make it effective for you, you need to tailor it for your unique problems. If you've found, after an analysis of your body mechanics that affect your lower back pain, that let's say you have a tendency to translate your hips to one side, or a hip hike on one side, or you have a tendency to side lean your torso more to one side than another, or you have a rotational problem, where you have one external oblique muscle working harder than another, or an overactive internal oblique responding for a transverse abdominis muscle. If you've found that you have a tendency to rotate your torso further to one side than another, you have an asymmetry, or your pelvis to one side more than another, you have an asymmetry in your alignment, your posture, your movement tendencies. You'll only know this if you do a good evaluation on yourself. If you have a rehab specialist that'll work with you, that's great. If not, go to the painfreeandfit.com website. We have a free body analysis that takes on some of the major points of this, but to really get a full analysis, check out any of our low back or fast track programs for lower back pain at the painfreeandfit.com website. You have to know what your mechanics are, you have to know what your tendencies are, because believe me, doing this exercise or any exercise, your mechanical flaws will come out, especially as you're trying to add reps or increase endurance time. The body gets fatigued It goes to its strengths. Our strengths are what we do all the time, which is typically our dysfunctions. Leaning more on one side. We have a favorite or stronger side one way, or rotation, or ability to lean, pelvic tilting. We all have these asymmetries, so you need to keep them in check. So for instance, in this exercise, let's say I have a tendency to hip hike with my right hip up on that side. During this exercise, I'm going to be conscious of pushing my right leg long through the foot, allowing my hip to move down away from my ribs. That makes this exercise tailor-fitted for me, not just a generic exercise. If I have a tendency to hip hike on the right side and I don't use this correction during this exercise, I'm strengthening the extensor muscles to hold myself in hip hiking. That's going to be aggravating my lower back symptoms as time goes on. If I have a tendency to rotate one side more than another with my torso or chest or pelvis, I'm going to put that into this exercise. Let's say that my mechanical situation is that I like to externally rotate my right thigh. I stand, I walk with that thigh out more. That means that the pelvis in relation to the thigh is typically off to the left side. I want to correct that by turning my pelvis to the right as I use the full spine extension. If I have a tendency to lean my torso to the right or the left, if I have a dominant lat muscle that runs from my shoulder to my back on one side, I want to lean my torso away from that side as I do this exercise. These corrections of twisting and leaning or pushing the leg long don't have to be great. Sometimes as little as 1/8 of an inch to be effective. But the key to it is that as I'm holding those corrections during this exercise, whether I'm doing repetitions up and down or whether I'm doing static holds, is I'm targeting a tailored way to strengthen not only my abdominal muscles as they hold the tail under, but my extensor muscles as they raise my torso up. If you like this video on full spine extension, feel free to subscribe to our channel. Got a lot of great videos out there to help you with low back pain. Thumbs up to help me share this valuable information with others. Questions or comments, write in as always. I'll do my best to answer them. And remember, if you're looking for a tailor-fitted exercise for disc problems, check out our fast-track degenerative disc disease program available at painfreeandfit.com. It'll walk you through the analysis of your mechanics, your posture, your movement tendencies, muscle imbalances, how to identify what your muscle imbalances are, and then a step-by-step program to implement corrective exercises, including full spine extension, to help you get your back in shape and get physically fit again in the least amount of time. I hope this video on full spine extension helps you with your chronic disc herniations, bulges, and degenerative disc disease.